Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. What is functional medicine? Functional medicine basically means using the same diagnostic tests, mostly blood tests, but some other tests that most doctors use to identify disease, and instead using those same tests, and often more of them, with a different metric, a way of looking at your health of your body to identify earlier signs of stress on your liver, on your kidneys, on your cardiovascular system and your immune system in ways and at times that enable you to restore normal health, to restore normal function. So functional medicine means using standard diagnostic tests to identify earlier signs of stress on your body so that you can heal yourself, so that you can reverse disease and not become dependent on pharmaceuticals or other invasive medical treatments for the rest of your life. Medical care is wonderful. Medical care is necessary when you need it, but a lot of people would like to be able to avoid it. And a lot of people, honestly, more people that come to me have already been through. They've already seen several other doctors. They've been through all of the tests. No one has been able to help them. They've seen specialists, and it's really frustrating when you go and over again be told that all of your tests are normal and there's nothing wrong with you, or even worse, it's all in your head. People really love to get a referral to a psychologist or a psychiatrist when they know they have a real physical complaint. No, of course, they don't love that. They're looking for a solution. So if you know somebody that has been to several doctors and been told that there's nothing wrong with them, somebody you love, maybe yourself, have a condition that no one else has been able to figure out the actual cause of and come up with a solution that will enable your body to heal itself again, then I'd love the opportunity to help you or them, and using functional medicine to identify earlier signs of stress on all of your organs. So a lot of the time, people have one condition that they're bothered with the most, and it's sometimes difficult to not kind of sometimes become obsessed really with that one thing. Oh, it's this, just if you can just fix this spot, I'll be happy. I have a whole bunch of other things going on, but I don't want to talk about that. I just want to focus on this one thing. Well, health and healing doesn't really work that way. Medicine, taking medication, one drug for one problem is sometimes important. But if you want to heal yourself, if you want to identify areas that need healing in your body, if you want a safe, effective, natural solution to a problem that's been bothering you or someone you love for a long time that no one else has been able to help, then that usually will require addressing everything in your body all at the same time, identifying problems with multiple organs and systems and nutrient deficiencies and maybe a chronic infection that you don't even know you have, things that don't necessarily fit what you might have been told about various conditions. But it's all about combinations, looking at everything that's happening in your body all at the same time. One of my favorite metaphors to help people understand this is what I call the river of life. Your bloodstream is kind of like a river filled with nutrients that all of your cells need to heal and repair themselves. And there are crews waiting along the banks of this river that are anxious to heal and repair some part of your body, do routine maintenance, fix a problem, cure a disease, and they require the necessary materials to do that. And oftentimes, many, many times, much of the time, for so many people, those basic raw materials needed to heal and repair your kidneys or your liver or your immune system, those materials are not available. They're not in your bloodstream. They're not in your river of life. So to heal and repair yourself, you need to identify all of the things that are missing from your river of life and replace all of those things, all of them at the same time, until your body is finished healing itself, so that those construction crews finally get all the raw materials they need to heal and repair everything at the same time. And a lot of times people say, I just want to try one vitamin. If you say this works, this one thing works for lowering my cholesterol or my blood pressure or helping with my arthritis, I'm just going to take that for a few weeks, and then if it works, then I'll try the next one that you recommended. Well, I'm sorry, that doesn't work. When your river of life lacks any of the essential nutrients that your body requires to properly heal and repair itself, then that is often what underlies the condition that no one else has been able to figure out, because you need all of the nutrients. You need to give your body, you need to flood your river of life with all of the nutrients required to heal and repair. And that is different than the practice of medicine. Medicine means identifying a single condition, usually, maybe more than one condition, but usually at least focus on one condition and one diagnosis and treatment with a pharmaceutical or a surgical procedure or some other invasive, often costly therapy that has side effects that most of us would rather avoid. And so, the alternative is to heal and repair yourself naturally by giving your body all of the nutrients it needs to do that. And to be able to give your body all of the nutrients it needs, you must first identify the ones that are missing. So that is what functional testing is for, using standard diagnostic tests to identify places where normal function is lacking, and giving your body the nutrients it needs to restore that normal function. So, unfortunately, insurance usually does not pay for functional medicine. Insurance does not pay to heal and repair your body. What goes under the rubric of health insurance, really there's no such thing as health insurance. What we call health insurance is not health insurance, it's medical insurance. Medical insurance pays to identify medical conditions that require immediate medical intervention with drugs, surgery, etc., not to identify whether or not you're healthy. So people go to the doctor all the time and they're told all their tests are normal and they're quote unquote fine. There's nothing wrong with them. Well, that's not true. Most medical doctors don't even ever look to see whether or not you're healthy. They look to see whether or not you have a disease that requires medical attention. So that's a big difference. I'm going to say that again. Most doctors, when you go to a medical doctor, most of the time for an annual physical or for a checkup or with a specific complaint, they're not checking to see if you're healthy. They're checking to see if you have a medical condition that requires medical treatment. And they're looking to see if you have something that they can bill your medical insurance for, something that is medically necessary. Health is not medically necessary. Medical necessity is based on the identification of a full-blown disease that you already have that you can't usually heal yourself from. That's why you need medical care, and that's what medical insurance is for. And that's a good thing. Everyone should have medical insurance. All of us are at one point or another, hopefully later rather than earlier, probably going to require at some point medical care. And here in the United States, we're blessed with among the most amazing medical care institutions. Hospitals, doctors, specialties, anywhere in the world, we can get amazing medical care to save our lives in a crisis when we need it. But it's also important to recognize that most of the care you get from most doctors is designed to heal disease, not to identify whether or not you're healthy and not to restore full, robust, 100% healthy function. Functional medicine, on the other hand, is designed specifically for that purpose, to identify deviations from normal health and restore normal health with better food, eating vegetables instead of junk food, with exercise, finding some way to move your body that you enjoy. It doesn't really matter how you move your body. It just matters that it's something that you enjoy so that you will do it. The best form of exercise is always something that you enjoy so that it's easy to work into and maintain as part of your normal daily life. And when those two things, good food and moving your body, don't do the job, then oftentimes supplements are often required to help heal the things that have been put off for too long, healing projects that have become delayed for far too many months and years. Sometimes your body needs a little support, and that's what we can identify on tests, that you have a vitamin D deficiency or an insufficient amount of healthy nutrients to keep your heart functioning, like coenzyme Q10 is a common nutrient lacking to heal and repair your heart. Interestingly, the statin drugs that medicine loves to tell everyone they need to lower their cholesterol deplete this essential nutrient for your heart. So oftentimes the medicine that might save your life in a crisis is also making that same part of your body struggle more to stay healthy, which sounds crazy because it is. So identifying nutrients that are missing from your body, from your river of life, your bloodstream, and repleting those, giving your body all of the nutrients it needs all at the same time, That's what restores health. That's what you'll see. That's what allows us to see 4 months later, 6 months later, 3 months later, when we retest the same blood tests and then identify the places that your body has improved in. So people wonder, how do you know, for example, that these supplements work that you're recommending? Or better food, how do you know that it really is that important to exercise or eat vegetables? Well, diagnostic tests. The only way I know to prove that something is working for any individual is to do tests, make recommendations that will address the things that show up on those tests, and then test again. So anytime you take someone and do a diagnostic test, provide some kind of treatment for the things that show up on those tests, and then test again, that's a case study. That's a legitimate, accurate way of measuring whether or not something is working so that you know. Sometimes when things are working, most of the time when you do something to make yourself healthier, to restore and repair the normal function of some part of your body, you feel that. You feel it immediately, and that's easy to detect, and it feels wonderful. But sometimes when you have especially a really chronic condition like irritable bowel syndrome or cancer or something that's been around for a long time, your tests might start to get better before you feel anything. Some conditions do require weeks or months even until your symptoms are gone and you feel perfectly healthy again. So using standard diagnostic tests can let us know if the treatment is working, sometimes even before you feel that change. And then, of course, most of the time you do feel changes quicker than weeks or months, and the diagnostic tests help confirm that you are, in fact, on the right track, that your kidneys and your liver and your heart and your digestive system and your immune system are working like they should. That's how you know if any treatment works. That's the only way I know to identify whether or not any particular supplement works. For example, people often ask me, how do you know this product works and some other product that I might have gotten from Costco or some store doesn't work? Well, give it to a few thousand people and test them before and after and see if it achieves the desired result on a standard diagnostic test. That's how you know if something works or not, for sure. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. We're talking about functional medicine, the restoration of health, the use of diagnostic tests to identify earlier signs of stress on your body. And unfortunately, medical insurance does not pay for this. Medical insurance pays for medical care in a crisis. It is not health insurance, it's medical insurance. It does not pay for anything that does any of the normal things that you normally do to make yourself healthier. There's no insurance that will pay for your gym membership or buy a new water filter so that you can drink clean water, or will buy you organic food or subsidize you growing your own healthy food. Anything that you do to maintain your own health is something that you have to take care of yourself. Similarly, the analogy I like to help understand this is like car insurance. Car insurance doesn't pay to keep your car healthy. Car insurance doesn't pay to get your oil changed or put new tires or new belts or hoses on your car or any of the things that you do routine maintenance on your car. Car insurance pays when you crash your car. And similarly, what we call health insurance is actually medical insurance, which pays when you crash your body and need full-blown medical care in a crisis. And if you think about it, this makes sense. The way insurance, any kind of insurance works is a bunch of us pool our resources, put them all into one pot so that when one of us needs help in a crisis, there's money there ready to take care of us. There's never going to be a way for you to pay money to some middleman to get you all of the care you need to heal and repair yourself. That's ongoing maintenance. That is the responsibility of everyone to take care of themselves. So there is, however, surprisingly to some, many ways of identifying the root causes of whatever is ailing you, and coming up with a means of healing your body and restoring yourself to full health when you have even severe conditions like full-blown diabetes. This is some of the things that I see, for example, which are often severe cases, are people that have had diabetes and been on medication for diabetes for 10, 20, 30 years. Oftentimes, you can still reverse diabetes, even if you've had it for years, even if you're on medication for it. If you take better care of yourself and identify all the things that are contributing to that, you can reverse diabetes. People come to me with cancer. I don't treat cancer. I don't ask people to come to me to get their cancer treated, but people show up with diabetes or arthritis or irritable bowel syndrome or some other condition, and I do a full case history like I do on everyone, and they reveal that they have cancer. They have breast cancer. This week I've had new patients that are recovering from breast cancer, another one who's recovering from prostate cancer, another one who's recovering from colon cancer. That's just in 1 week. And so I explained to them that I'm not going to treat their cancer, quote unquote, air quotes. That's the province of oncologists. But whatever you show up with, I am going to identify places where every part of your body needs a little bit of help and show you how to give it that help so that you can heal and repair yourself. And that often results in people getting better outcomes. If they're going through cancer treatment now, if they're going through chemo and radiation, you can do healthy nutrients, eat better food, exercise a little bit, and take some nutrients that are lacking that your oncologist won't check for you. I can identify those things and show you how to alternate, not the same day. You don't want to take a lot of supplements when you're going through chemotherapy, for example. Or sometimes other forms of cancer treatment, radiotherapy, immunotherapy. But you can still do both at the same time, meaning in the same weeks or months period that you're going through, just by not doing it on the same day. You don't take all your vitamins when you go in that day to get chemotherapy, but you're usually getting that in cycles anyway. So on the days that you're not taking chemotherapy, after waiting sometimes a day or two, then you can flood your body with all the nutrients it needs to recover from the damaging effects of the chemo and give your body a better fighting chance to heal and recover from cancer. So that's not treating cancer, that's treating a person and restoring the health of a person that has cancer. And among other common people that I see all the time are people, there are millions. I think the last count I heard statistics, something like 20 million cancer survivors in the United States alone. So there are better treatments. Even those standard medical treatments get better and better for some cancers, like breast cancer. A few of the other cancers, the medical treatment is getting better, and lots of people are surviving. And the downside of that is once you survive cancer from standard oncology, then you're usually on your own. They might have you come back in a year for tests to make sure the cancer is not coming back, because you can identify cancer fighting activity in your body before it will show up on a scan on blood tests called tumor markers. In fact, most oncologists never use these tumor markers until after you've been treated for cancer, because they know what kind of cancer you have already, which has been identified on scans. And they know that before cancer, if it comes back, before it will show up on a scan, there are blood tests that will identify cancer-fighting activity before it shows up on a scan. So that's why they use those tests. But you can also, any doctor can use those tests to identify cancer-fighting activity in your body that's happening right now before it's big enough to show up on a scan. Before you get a diagnosis of cancer, you can use these same tumor markers to identify cancer-fighting activity. So most doctors don't do this before you have cancer, because there's no treatment, there's no standard medical treatment for early signs of cancer developing. They're not going to give you chemotherapy or radiation if you have early signs of cancer-fighting activity, and you can't diagnose cancer with standard tumor markers. You have to diagnose cancer by seeing it on a scan, on an MRI, on a mammogram, on an ultrasound, on an X-ray, on a CAT scan, etc., PET scan. These are ways that you diagnose cancer. But you can identify cancer-fighting activity anytime with tumor markers and help your body, support your body, give it the nutrients it needs to heal itself and give you a better fighting chance to survive a cancer and prevent its recurrence, lower your risk, reduce your risk of that cancer coming back. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. I've been getting a lot of new patients coming in, listeners to this show, with various conditions, sometimes simple things like just not being able to lose weight. I have a woman who came in who's, knows she needs to lose weight and has tried everything, quote unquote, that you're normally told to do, and it's just not working. And there are a lot of reasons for that can be identified on testing, such as low thyroid, borderline low thyroid. You can go get your thyroid tested, your TSH by your standard general practitioner and be told that your thyroid is fine and still have functioning low thyroid. You can be told that you don't have anemia and still have functioning anemia, iron deficiency, B12 deficiency that will show up on tests if you know how to read them for normal health as opposed to just a full-blown disease that requires medicine. So there are a number of reasons that people have fatigue and difficulty shifting weight that fly under the radar of standard medical treatment but can be identified on proper functional testing. And toxins is another huge one. People with rashes that no one has been able to figure out how to treat, and they've been taking every kind of cream or allergy medicine or corticosteroid medication, and it just never goes away. And that's often because of toxins. We're all exposed to toxic chemicals and pesticides and fertilizers in the food we eat and the air we breathe, and wildfire smoke, which I've talked about many times before. And there are just a whole host of things that make it really difficult for your body to heal and repair itself. And exposure to heavy metals, mercury, lead, arsenic, cadmium, uranium, these things are identifiable on tests. Interestingly, the toxins are not usually very well identified on blood tests. Blood tests are the standard test for most things, but not toxins. Toxins are flushed out of your bloodstream as quickly as your body can possibly flush them out. Your kidneys and your colon, your liver will identify the presence of toxins that you're exposed to and flush them out as best as it can. But when you're exposed to heavy metals like mercury or lead or arsenic, or chemicals like organophosphates, fertilizers, pesticides, Roundup, one of the most common pesticides used that all of us are exposed if you're downwind from a farm anywhere that's being sprayed with standard chemicals, or just even on your yard. People spray Roundup on their grass and their yards and then go out and have their kids roll around in that toxic soup. I hope you don't do that, but people do. And these things don't show up on blood tests unless there's a huge recent exposure. So people that might have been exposed to these things years ago, decades ago, 10, 20, 30 years ago, if what your body is unable to fully excrete from your bloodstream, it will shove into fat cells to get them out of circulation. So if you have, if you live in Flint, Michigan, and you know you were exposed to lead in your water and your blood test comes back negative, that doesn't mean that you weren't exposed like everyone else. It just means that it's not enough of it to show up on a blood test. And the better test to do for heavy metals is a hair test or a urine test, because hair test measures chemical toxins and heavy metal toxins that are excreted through your hair follicles and your sweat glands and accumulate in your hair as it grows out. That's why they use hair to do drug testing, because things that are excreted from your skin accumulate in hair as it grows out, and you can test and identify those things with a hair test and then do an appropriate treatment and retest again to make sure that your body burden of those things is eventually coming down. So we're all exposed to these things, and if you haven't been tested for toxins like these, and you have a condition that no one else has been able to help, especially a skin condition, a rash, or cancer, or anything wrong with your brain, a mood disorder, anxiety, depression, or a chronic problem with the brain like Alzheimer's or Parkinson's disease, or neuropathies, anything that affects your nervous system, your immune system, these are often conditions that involve toxins that need to be identified and eliminated so that you can heal yourself better. So I love helping people understand this. If you know someone who's just not getting the treatment they think they should have, they're probably, if they don't feel well and they're told that there's nothing wrong with them, well, that's not true, of course. If they were perfectly healthy, they would feel good. So if something is wrong with you, you know it. If somebody tells you there's nothing wrong with you, then please send them to my office, give me a call, and we'll figure out what is wrong and identify. Most of the time, we can identify a safe, effective, natural solution to almost anything that ails you. Thank you so much for tuning in today. I love answering questions. Text me, email me with any questions you may have, and we'll bring them up on the air. Or privately, I can just respond to your email directly if you prefer that too. Thanks again for tuning in. Have a fabulous weekend. I look forward to speaking with you again right here next Friday.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 2 p.m. for safe, effective natural solutions here on 98.3 FM, The Word.